My goal with doing this is twofold. I have to get rid of the ingrowing part, but I also have to leave a good cosmetically looking toenail behind. Hey guys, it's Dr. Carter at Lexington Podiatry, and I have the toughest little man here today. We're gonna do an ingrown toenail. It's not a terrible one, but that's how I want them. I don't want you to come in here with a big old toenail that's all red and swollen and draining. I want you to do like he did and use the pink salt and soak it and get rid of all that gunk so we can take care of the toenail. So here what we have, his toenail is a little bit ingrowing on both sides. This one's not causing any trouble, it's over here. We have it covered in betadine to clean it off, but it's really red and the skin is actually kind of peeling and getting a little bit thicker in there. And that's a sign that the toenail is becoming a problem. So we're gonna get started. I've already got him numbed, hopefully. We're gonna test him in a second. But I squeeze it and I put a tourniquet on it. That's gonna push all that blood flow away from where I'm working. And then we're gonna test it. How about here, sweetheart? Do you feel any of that?
Nope.
Good. How about here?
Nope.
Perfect. He's gonna be the best patient ever. All right. Are you okay with me talking and telling what I'm doing?
Okay.
Right. Good enough. First step is to separate the skin from the nail. We have to get rid of the cuticle here, separate the skin on the top, and then we have to go underneath. That's the part that always looks super painful and traumatic. Now we're just gonna clip the nail. My goal with doing this is twofold. I have to get rid of the ingrowing part, but I also have to leave a good cosmetically looking toenail behind. He's young, he's got his whole life ahead of him, and I want to make sure that I don't leave him with half of a toenail. So I cut a small little sliver. You can see how far underneath the skin that goes. So it's like the root on a tooth. It goes down under there and anchors itself, and that's where the ingrown actually starts from. So in order to fix it, we get rid of that part. So I'm gonna make sure I got it all. I did. Perfect. So now what's gonna happen is as this heals, once we put the chemical on it, of course, but it's gonna fold over and cosmetically, you're not even gonna be able to tell that his nail's gone. So that's what we're looking for. Perfect. This is the chemical. We use sodium hydroxide, Q-tip dipped in it, and we spin it around for about 10 seconds each. You see that there's some fluid there, and that's from just the medicine on the Q-tip. Sometimes this does turn dark. It's a chemical reaction between the sodium hydroxide and blood, so that's normal. We do 3 applications, and I'm working pretty hard to push it down in there. I also like to put my other finger on the toenail and push down so none of the medicine sinks up under there. I want the toenail left to be nice and healthy. Just clean it out again, make sure I didn't miss anything. And this is the final one. And he didn't feel a thing. That's how we like it. Perfect. This is vinegar saturated cotton balls. We're gonna clean it off. That helps to neutralize the medication on the skin and kind of stop the cooking process. And beautiful. We're gonna wrap it up. We've got some antibiotic ointment on a gauze here. That's gonna keep it from sticking. When we do these procedures, they tend to bleed, and so the blood can dry onto the gauze and cause problems taking it off. That's why we normally recommend that you take it off the very first day, later on this evening, so it's not gonna be all stuck and yucky. Perfect. Look at that, one cute little package. And there's one final step. You can look at it now because it's all wrapped up. But this is the thing that's going to make sure that it heals the way that it's supposed to. Look. Perfect. All right, guys, there you have it. Just a run-of-the-mill ingrown. Don't let them go. Don't let them become painful. There is an option. We can always fix it. If you like videos like this, make sure you like and subscribe to our channel. Have a great day.